Did you know 70% of people quit these so called miracle weight loss drugs within 2 years? And the shocking part, you don't just lose fat, you lose muscle and set yourself up for rebound weight gain. Let's uncover the truth. Hey everybody, my name is Mark Bates. I'm a metabolic health coach, and this is my video on rethinking weight loss, the failure of GLP-1 drugs, and the path to sustainable health. So let's get into it. 70% quit these weight loss drugs, right? I'm not going to mention brand names on here, but they're GLP-1 agonists, and I think you know which ones I'm talking about. The numbers tell a story pharmaceutical companies don't want you to hear. 70% of patients stop taking GLP-1 agonists within 24 months. This comes from real-world data tracking nearly 5,000 patients, not the carefully controlled clinical trials you see in advertisements. The median time to quitting? Just 13 months. But the discontinuation rate represents only the surface of a deeper metabolic crisis. When researchers examined what happens to patients using these medications, they discovered something alarming. There's a muscle disappearance problem. DEXA scans reveal the hidden cost of GLP-1 weight loss. In the landmark Step 1 trial, lean mass accounted for 39% of total weight loss. The Sustain 8 trial showed nearly identical results at 40%. This means patients lose substantial muscle and bone alongside fat. Think about what this means. A patient loses 30 pounds on semaglutide. 12 pounds of that comes from muscle and bone tissue, critical for metabolism, strength, and physical function. The loss becomes particularly severe in older adults who already face age-related muscle decline. For them, GLP-1 induced muscle loss accelerates frailty, increases fall risk, and reduces physical capacity. But the biological story gets more complex. Did you know your body creates more fat cells? GLP-1 agonists trigger a process called adipogenesis. They stimulate the formation of new fat cells from precursor cells, increasing the total number of fat storage units in your body. During treatment, these extra fat cells stay small because the medication suppresses appetite and lowers insulin. You lose weight despite having more fat cells. The problem emerges when you stop the medication. Those additional fat cells create expanded storage capacity. When appetite returns and insulin levels normalize, rapid fat regain becomes biologically inevitable. Traditional caloric restriction works differently. It shrinks existing fat cells without creating new ones. This explains why GLP-1 discontinuation often leads to worse body composition than before treatment started. The receptor shutdown effect. Chronic exposure to supraphysiological GLP-1 doses, that means outside what your body normally produces, right, create a biological paradox. After 18 to 24 months, many patients experience an efficacy plateau. Weight loss stalls despite continued medication use. Post-market surveillance data shows this pattern consistently across patient populations. The mechanism involves receptor desensitization. Prolonged overstimulation reduces the sensitivity and signaling capacity of GLP-1 receptors. Your body's natural GLP-1 production also decreases. This creates metabolic dependency. Stopping the medication leaves patients with compromised endogenous GLP-1 function. This means your body can't produce it itself as well anymore either. Impaired appetite regulation and expanded fat storage capacity. Not what you want. The rebound timeline follows a predictable pattern. Weight regain begins within weeks of discontinuation. Most patients return to or exceed their original weight within 2 years, but the regained weight comes back as predominantly fat, with muscle mass remaining depleted. It's exactly the opposite of what you want. And then there's an economic story to tell about this one. GLP-1 agonists cost approximately $800 to $1,000 monthly. Annual expenses reach $13,000 to $17,500 a year for medications, right? Like these. For older adults with median incomes around $30,000, this represents 59% of annual income. The financial burden makes sustained treatment impossible for most patients without comprehensive insurance coverage. Even with insurance, discontinuation rates remain staggeringly high. A majority administrative claims database study tracking 4,791 patients found the median time to discontinue was just 13 months. The cost-effectiveness analysis reveals the economic failure. Research from the University of Chicago shows tirzepatide would need a 30% price reduction to meet standard cost-effectiveness threshold. Semaglutide would require an 80% price reduction. These calculations assume perfect adherence and sustained benefits. The real-world discontinuation data makes the economics even worse. And while with your insurance you may not be paying that full price, somebody's paying for it. So just keep that in mind. Okay? The superior alternative. Multimodal lifestyle interventions achieve 82% adherence rates over 12 months. This directly contradicts the narrative about patient compliance with dietary approaches. So this is changing to an effective one, right? The adherence comparison exposes a fundamental misconception. Patients stick with lifestyle interventions at nearly 3 times the rate of GLP-1 medications, right? One of the key things here, though, is stick to a dietary approach that doesn't keep you hungry. If you just do caloric restriction, right, then all you're doing is you're still continuing to eat all the carbohydrates before, you're just reducing the amount, and you're still producing all the hormones that make you hungry. You need to switch to a ketogenic or a carnivore lifestyle, which produces natural satiety, so you're not feeling hungry, actually upregulates your GLP-1 regulators. Your body produces a lot more of its own GLP-1 when you're eating a ketogenic or carnivore diet. So that's part of the reason you don't feel as hungry. And it's very easy to stick to, because the thing that everyone hates about diets is feeling hungry all the time. Well, if you're not hungry, it's easy to stick to the diet, okay? The economic contrast is equally striking. Evidence-based dietary interventions cost less than $100 a month, including professional nutrition guidance when desired. That's above and beyond what you normally would pay for your groceries. Now, I think you actually, if you go to a carnivore diet, and I've tracked this on my own budgets, you actually spend less on carnivore than you do on regular stuff because you're not buying all those overpriced, overprocessed foods. So just keep that in mind. And exercise can be self-directed at minimal cost. Exercise can be as simple as walking around the block several times. Okay? You don't need to have expensive equipment. You don't need to go to an expensive gym. Those help, but trust me, you can do walk around the block, maybe do some push-ups, right? Things like that are very effective exercises. Weight loss outcomes match or exceed pharmaceutical results. In my opinion, almost always, if not better. Most importantly, muscle preservation remains intact with proper dietary approaches, and that's the big one, right? You don't lose muscle when you're eating a ketogenic or carnivore diet because you're getting plenty of protein and you're not starving yourself. Patients avoid the gastrointestinal dysfunction, receptor desensitization, and metabolic rebound associated with GLP-1 therapy. Okay? So just remember that. GLP-1 therapy, it's a quick fix that hurts a whole lot. Okay, so why does the systems continue to promote failure? Well, the continued aggressive promotion of GLP-1 agonists, the despite poor real-world outcomes reflects systematic healthcare dysfunction. Pharmaceutical profit motives drive marketing campaigns worth billions annually. GLP-1 medications represent some of the most profitable drugs globally, creating powerful incentives for widespread promotion. Uh, Medical culture favors pharmaceutical solutions due to time constraints and perceived patient expectations. Prescribing a medication takes minutes. Implementing comprehensive lifestyle interventions requires sustained engagement and system support. And here's the big one. Insurance reimbursement structures amplify the problem. Coverage often favors medication costs over nutrition counseling, exercise programs, and behavioral therapy. This is starting to change. It's getting easier to get your insurance to pay for gym memberships and nutrition counseling than ever before, because guess what? They're getting hit with $1,000 a month bills that they're covering for something that they know, based on the studies, is not working and actually worsens the problem. So the insurance companies are wising up eventually to this. The classification of obesity as a chronic disease facilitated insurance coverage for drugs not necessarily for lifestyle interventions. This creates a perverse incentive, promoting expensive, poorly tolerated treatments over effective, sustainable approaches. Okay? There is a path forward. The evidence demands a fundamental shift in approach. Healthcare funding must expand coverage for nutrition counseling, exercise programs, and behavioral therapy. Reimbursement incentives should reward providers who achieve sustainable metabolic health improvements through non-pharmaceutical means. Physician education needs emphasis on lifestyle medication, right? GLP medications might serve as short-term adjuncts, but the focus must remain on building sustainable dietary and behavioral changes. And if you go on carnivore, after you go through a proper introduction period, between 4 and 6, maybe even 8 weeks, you're producing so much GLP-1 yourself and other hormones that make you not hungry that there's absolutely no reason to go on a short-term version of a GLP agonist. Okay. Patient education also requires honest disclosure. Has your doctor told you you can get the GLP drug, but have they really told you what happens? Have they told you about the 70% discontinuation loss, the muscle loss consequences, the rebound weight gain that represent critical information that you need to have? Also, take a look at the number of lawsuits being filed against Novo Nordisk and some of the other producers of these drugs. They're starting to build up now, okay? It's just something to be aware of. The cost effectiveness data should also inform policy decisions about resource allocation in a healthcare system, right? Some research groups are exploring alternative models. Will GLP-1 medications provide initial weight loss before patients transition to lower cost maintenance interventions? Yes, I see that, and it can work, but once again, my problem is that it's still very expensive, even for maybe that 2-month period that you might use it. And it's so much easier to cheat if you're pushing a drug in your stomach than it is to actually change your dietary patterns. Okay, it takes a little bit of effort, but not much, especially if, once again, you don't get hungry. And that's the big thing with carnivore and ketogenic diets. You don't get hungry. Okay? So the fundamental question remains, why prioritize expensive, poorly tolerated treatments when evidence-based dietary approaches achieve superior adherence and avoid the metabolic complications? Ask yourself that. The answer lies not in medical science, but in economic incentives that prioritize pharmaceutical profits over patient outcomes. And that's why they keep pushing the drugs. Okay? So the data is very clear. 70% of patients quit these medications. Most regain weight with worse body composition. The economics fail basic cost-effectiveness standards. Meanwhile, lifestyle interventions achieve higher adherence, better long-term outcomes, and dramatically lower costs. The choice seems obvious, but changing entrenched systems requires confronting powerful interests that benefit from the current dysfunction. The patients deserve you The patients deserve better. The evidence shows a better path exists. All right. Thanks for watching, everyone. If you have some questions about this, let me know. If you want to know how you can start a ketogenic or carnivore diet properly and get all the benefits without all the costs and all the medical issues, ask me. We have programs for you, right? They're very easy and they're not that expensive. My group coaching program is only $10 a month, okay? And it's coming out October 1st. So keep that in mind. Also, if there's something else you'd like to know about, we're here to answer your questions, whether you're part of the coaching program or not. Leave me a note on what you'd like me to do a video on. We'll get right to it, all right? As soon as we can. And as always, if you haven't done so, please like this video, subscribe to the channel, share it with a friend. You help a lot of people. You help this channel. Thank you very much for it, and have a great day.